Thanks, everyone. So our next speaker is Professor Martin Cake, who's come all the way from Murdoch University in Perth, Australia. So Martin is a vet and a musculoskeletal researcher and passionate about veterinary education, including teaching, curriculum development and educational research. And Martin's particular passion is around developing professional identity, and he's going to talk to us.
Thank you. Yes, this is a couple of slides. So this is this is challenging. So thank you for the introduction. Yes, I am from Murdoch University in Perth in Western Australia. I am a veterinarian, and I actually don't do a lot of musculoskeletal research anymore. No, but I've done. I switched about 10 years ago into veterinary education, and I think it was actually a really one of the best decisions I ever made. My connection to this topic is primarily through my research in veterinary employability, which I will present at the end. Yes, developing, I've come to realise professional identity formation is actually at the heart of a lot of what we do. So I've, using this slightly strained analogy of Miller's pyramid as a physical mountain we will climb, hopefully you'll play along with that. So I wanted to think about the outcomes frameworks that we use and the shared mental models that we work with that guide our learners and our learning design, and of course help with actually certifying achievement. So this dune here this is the Big Daddy dune in the dead fly in Namibia. I was there, lucky to be there last year. There's actually an excellent little vet school in Namibia, which I would encourage you to get involved with. And this has now become my go-to analogy for learning and feedback and assessment, is people climbing this great dune. And of course, this is always the formula for learning, is where are you heading, where are you now, and of course you need how to get there, and you need the feedback to actually work that plan out. So we always need models and frameworks and a sense of where we're going and where we're heading and what is at the top of the pyramid, or the mountain, the dune in this case. So Miller's pyramid, for those that are unaware, I'm assuming probably most of you would be aware of it. Miller's pyramid was actually developed about 35 years ago now, so quite a well-developed model, and immediately highly influential, and it has had a very persistent influence ever since, although it's been slightly modified. It was very innovative at the time for integrating what is still, unfortunately, quite traditional assessment, exam-based, knowledge-based type assessments with workplace-based assessments. When it was first published, probably most innovative for that sort of shows how level, which was obviously involved in simulation before actual practice. And at that time, the top level, the DAS, was really uncharted territory. Of course, we've now really started to move into that top level, as we've just heard, with much more sophisticated workplace-based assessment. The descriptors, so performance, competence, etc., have probably changed a little bit in the words that we tend to use, but this model, in terms of its layering, knows how, shows how, and does, is still very widely used and one of the most important models for assessment in medical and in veterinary education. We often see it now in this form, which is basically a combination with the I've forgotten the name of it. That's all right. The other pyramid that we use. But basically the idea that we're actually, what we're doing in climbing this pyramid is, in the move from novice to expert, we're developing assessments that, of course, move closer to reality. In moving to more authentic assessment, we are increasing the complexity and the authenticity of the assessment. We're aiming for a gradual withdrawal of supervision, and that, of course, now is what we think about as entrustment. And we're aiming for the learner to have increasing self-regulation and agency. So, for those that are familiar with Miller's pyramid, I thought it would be a nice idea to actually think about how we can extend that. Now, I know some of you, or many of you perhaps, will know of a couple of proposed extensions of this pyramid, in fact some that are widely used. But I think for veterinary education and for postgraduate education, I'm not sure Miller's pyramid does all of the work that we need to do. So I was aiming to just be slightly provocative with this talk, hopefully just gently provocative and not too provocative, think about how we could actually add to this pyramid and actually find some new words or verbs that could extend this pyramid for the purpose of postgraduate veterinary education. So I would like some audience participation. I might give you maybe a 2-minute exercise to talk to a neighbour. If you already know some words that have been added to the pyramid, maybe try and find some new ones. So a challenge for you. So 2 minutes. Talk to a neighbour, come up with some new verbs or new phrases that we could add to Miller's pyramid that would extend the vision through the transition into postgraduate veterinary education to build a more consistent framework. Okay, thanks. That's around about 2 minutes. I didn't time it. Does anyone want to shout out some bright ideas? I don't know if anyone came up with some words they want to shout out. Explains why? Yeah, nice. Creates. Refine. Teach. Adapt. Yeah, nice. Excellent. Okay, thank you. So some great ideas there. So there are, as many would be aware, have been a couple of proposals to extend the pyramid. One is to add trusted to the top of the pyramid, and of course we have the author of this paper in the audience, so to watch, be a little bit careful here. So the addition of trusted is of course to recognise that the idea of entrustment and the work now that's done by EPAs, entrustable professional activities. I'm sure most of you would know what these are, but these are units of professional practice that can be entrusted to a trainee, and the idea is to judge the level of supervision that's required. A very important thing for veterinarians who of course go into independent practice in theory at graduation. So, of course, the thing about trust is that what we're doing is we're managing uncertainty and risk. And so actually the idea of trust encapsulates quite a lot of very useful things. First of all, it encompasses the idea of not just evaluating past performance, but actually evaluating future performance in unknown contexts, hence the idea of uncertainty and risk. It also encapsulates our confidence in the trainees' help-seeking behaviours. If we're going to trust them, we need to know that they will know when they're out of their depth, that they will seek help, and that they will basically be self-regulating in terms of what they attempt. The idea of trust also encapsulates their motives. To trust someone, we need to know not only that they're competent, we need to trust that they actually have what we would view as a correct internal moral compass. They've got the morals and the ethics and the motives. That's all inherent in trust. And confidence is a big part that's encapsulated in trust as well. So I just wanted to just briefly talk about confidence. There's not a lot written on confidence, and you'd be surprised at how flimsy a psychological construct confidence is in the psychological literature. It's something that we talk about all the time, and certainly we're all familiar with graduates and of course undergraduate learners who are perfectly competent but fail in terms of their confidence, and we're also aware of the opposite. Trainees or learners who are overconfident and really don't have a good handle on their own competence because of the failure of their self-assessment. So confidence is a really important moderating factor of competence. And it's very important that what we're aiming for here is not that there is any particular right level of competence, but we can also see a kind of sweet spot between underconfidence and overconfidence, both of which carry risk, and they both carry problems for performance and problems for the team. So we must, what we're aiming for is for our learners or trainees to be in that sweet spot between underconfident and overconfident. And of course, they cannot rely on self-assessment for that. They're going to need feedback. And what we're aiming for is not any particular level of competence. Of course, what we're aiming for is the correct level of confidence that matches their competence. In other words, we're aiming for the confidence to competence ratio to be level throughout. So it's quite a tricky construct to work with because it's basically always dependent on the level of competence. Okay, so that's one level. The other proposed level of Miller's pyramid, and this one has penetrated fairly widely, and often you would see this formulation of Miller's pyramid with is or being added to the top of Miller's pyramid to reflect this really central role of professional identity formation. This is the critical paper that made that amendment, and this, again, has been highly influential. This is the idea that we're not just interested in our learners doing the things a clinician or a veterinarian can do, but actually, as you see, to think, act and feel like a clinician. So they're not robots, they're not just performing behaviours. We are actually trying to look inside their head and trying to assess whether they have a fully integrated kind of professional self, moral self, which is an anchor for their decision making. And that, again, would embody the trust that we were just talking about. So this concept of professional identity has replaced all of the classical ideas of professionalism, which originally, I guess in the first wave of professionalism teaching were based around values. In the second wave were based around sort of professionalism. And now we think about professional identity formation. It's now the kind of modern conception of professionalism. And this has been described, and I would tend to agree, that this is actually the highest purpose of medical and veterinary education. And I guess the problem with it, of course, is that just like trust, we're actually interpolating a lot of our what's inside a person's head. We're interpolating motives, values, and attitudes, and they're all in a person's head. So if this is the main game, but it's inside our trainee's head, how do we measure it, and how do we work with that? So there are some major challenges with professional identity formation. Some are being outlined in this recent paper. The problems of that professional identity formation is a process. It's a developmental process. It's not really actually a behavioural outcome. It has to be assessed holistically and longitudinally. We can't really assess it from compilation of lots of small assessments. And most problematically, it's highly individualised, highly personalised. I've taken the liberty of giving you a preview of tomorrow's talk from Ollie Carter with his very, very useful model of the idea of different layers of competence, which we're going to hear about tomorrow. So I won't, of course, steal his thunder, but I just wanted to point out to note that this personalised competence, this professional identity formation layer, increases and becomes more and more and more the main game as we move post-graduation and into advanced certification. The training becomes more and more individualised, more and more personalised, harder to standardise, and of course we're already working with something that's hard to measure. Now we've got something that's highly variable, highly personalised. Okay, again, just a little bit of a sidebar, a detour into Maslow's pyramid, or as Maslow's hierarchy of needs. So another mountain to climb. Just to note the obvious similarity between the tip of Maslow's pyramid of self-actualization and the idea of professional identity formation. So Maslow's pyramids of needs was a psychological construct. It's been sort of debated about whether it's a true pyramid, but it's the idea that we all have a number of needs, some physiological, some psychological, and at the top of this, the tip of the pyramid, is self-actualisation, which is basically achieving our best self, achieving one's true potential. And you can see from the words there, this sort of is proposed to sort of free us into a higher plane of being, creativity, spontaneity, problem solving, etc. These days we've updated this pyramid by adding layers to the bottom, which is very, very important additions. The other obvious analogy to make here is with eudaimonia. So people might not be familiar with this word, a very useful word and a very useful concept. Eudaimonia is actually a type of happiness or flourishing, so it's an element of well-being. And the word eudaimonia, it's a very ancient Greek word which basically means your true spirit, or it's basically your inner demon, basically, but demon as a spirit. The idea that the highest goal for human beings is to be your best person, basically to achieve your best possible self, and that this is the highest thing that human beings can strive for. And this is more important than happiness in terms of hedonic happiness. It's actually the well-being or the happiness that we get from striving to be our best possible self, which we experience. The well-being is a side effect of that, trying to live that life. Okay, so I'll come back to that when I talk about well-being in a moment. I just wanted to show you this really interesting paper which sort of illustrates some very interesting things about professional identity formation. I thought this is a really interesting study. This was done in 9 Texas medical schools, about 3,500 students. And what they do, there really aren't highly validated measures for professional identity formation. So this group played around with this visual analogue scale and these little pictograms, asking medical students to basically define in the first set of pictograms whether they felt part of the group. So did they feel like they were part of a physician group, and how well merged their personal and professional identities were, just with very simple sort of visual analogue pictogram, which I thought was really, really novel and interesting approach. But you might be shocked by the results. So some quite interesting findings there. The first thing to note is that these 2 sets of measures, both purporting to measure professional identity formation, were not particularly highly correlated, but they both appeared to measure something to do with professional identity formation. The other interesting thing is to look just how spread out, so the final column, the right-hand column of each of those graphs, would be final year medical students. And you can see the enormous spread across that scale. We have some students, particularly on the first scale, they're just about to graduate and they feel next to no connection to being a doctor, which is actually quite shocking. And if we think of how important this is, so it tells us a few things. It tells us that this is highly variable. All students move at different rates, and actually you can see they bounce up and down a little bit, so this is non-linear development. And it also tells us that for a large number of students, a lot of this professional identity formation is a postgraduate phenomenon. So, or may never occur. We just don't know because it's so hard to measure. And highly, highly heterogeneous. So I thought that was a really interesting study, really eye-opening. This is another important study in the veterinary space, which again just illustrating some. So this is quite a small study by Liz Chan. She's not here, but she's presenting some of her work. A colleague is presenting some. This was a small study of about 12 recent veterinary graduates, a narrative inquiry study. And what she found was that some of those graduates had what she called a diagnosis-focused identity. Their value was placed on finding the answer, always finding the diagnosis and getting it right. And of course, that's perhaps the prevailing identity of clinicians in referral hospitals. It's kind of, I guess, the hidden curriculum in our university training system. And she found that other graduates had a more challenge-focused identity. They were happy to sort of prioritise technical competence alongside the decision-making, so that they actually valued the challenge of not necessarily finding the right answer, but solving the problem. And what she found was that this second identity was more likely to be fulfilled in general practice, obviously, with sort of spectrum of care type approaches. And she also noted that this was more likely to be associated with better well-being and satisfaction in work. So it sort of suggested that there may be sort of maladaptive identities or that don't fit with reality, and that there are obvious identity transitions that need to be made. So professional identity formation is disruptive and needs to change in different environments. Okay, just finally on professional identity formation, just want to mention this really critical paper, which introduced the idea that professional identity formation is really heavily influenced by three factors. It was proposed to be reflection, relationships, and resilience. And it was quite nice to see this was actually endorsed by a recent factor study, so confirmatory factor analysis, which actually demonstrated the tight links between professional identity formation and resilience, noting, of course, that both of those are fairly hard to measure. But in that study, the strongest association was with resilience. That this number here is 0.70, I think, in terms of the correlation. That was done in the Royal College of Surgeons in Dublin with preclinical medical students. So professional identity formation is an important part of well-being as well as of professional learning. So one theory that we could use to link this and to explain this, I think quite a useful theory for understanding quite a lot of learning and quite a lot of well-being, is Ryan and Deasy's self-determination theory. The idea that human beings have three fundamental psychological needs around competence, autonomy, and relatedness. So humans inherently desire mastery and just want to be good at what they do. They also want to be in control, and by in control, it's not just about making their own choices, but it's about being able to do the things that they find valuable, and basically to find congruence with their value system is what we describe as autonomy, and relatedness, because human beings are very social creatures and always want to, basically will find happiness in social situations, believe it or not. This is another part of that framework, basically talks about the difference between types of motivation and the distinction between intrinsic and extrinsic motivation, and posits that well-being is found at sort of the right-hand side of this spectrum. So in truly intrinsic motivations, but also importantly in internalised extrinsic motivations, which basically means, again, this idea of finding congruence, alignment with your value system, and basically you're taking an extrinsic motivation, like for veterinarians it's often helping animals, healing animals, and basically internalising that into your value system, and it basically becomes an intrinsic motivation, and hence part of your reward system that will give you well-being. So that is not, self-determination theory in itself is not necessarily a well-being model, but it actually sort of incorporated quite heavily into a number of well-being models. Here's a couple of examples here. I particularly like Elona Bonnywell's idea of eudaimonia as, so she sort of analysed it and described it as a very broad umbrella, but she saw two basic elements of eudaimonic well-being: in personal growth and in transcendence. And transcendence is not necessarily anything spiritual, it's about meaning and purpose. It's about service of something bigger than yourself. So she saw eudaimonia as based in improving yourself, being the best person you can be, but also doing something good in the world, some sort of higher purpose. This is a really nice taxonomy of mental health, which was just recently published by an Australian group, which I thought people might quite like to see, which actually shows in well-being This is a well-being, a positive mental health model, basically just a sort of taxonomy of all the different elements, and it shows exactly what we're just talking about in postgraduate education, which is not just feeling good, that's the kind of happiness part, but a congruence with yourself, so this integration of your personal and professional self and your values. You're happy not just in your life, but with your life. You're basically feeling that you're living a good life and that you're aligned with your autonomous goals, and you're functioning well, you're competent. You have meaning and purpose in your life. You're engaged in your work. So these are all critical parts of our well-being, and these are what drives people to do things. This is what motivates us, keeps us happy, and keeps us well. Okay, so I wanted to propose a couple of additions that we could add to the pyramid. We had some excellent suggestions before. I think we had something along the lines of this, which is pursuing. So we get to the top of Mount Miller. We're now a clinician. We don't always want to just go to the next level and keep learning new things. Sometimes we want to stop and just do better. We just want to pursue quality improvement. We want to just consolidate and get better and more confident of what we're doing. So I think this is a really useful paper that was published a few years ago in Vet Record. Sorry, I didn't give the reference there. But this was looking at defining quality care in a veterinary setting. And I thought this was really useful. The idea that quality of veterinary care is not only in patient outcomes, it's not only about safety and efficacy, and patient-centeredness, which of course are all important, it's also about efficiency and timeliness. So that's not something we typically build into our assessment systems, is the efficiency of work, but it's something definitely that graduates will struggle with. And as we note there, it's about what it gives back to the actual provider. The clinician, the veterinarian, what they get from the encounter is part of quality, because that is what makes it sustainable. So the other word that I would add to the tip of Miller's pyramid is not just doing, but keeps doing. And that's what I would probably propose if I was redesigning Miller's pyramid. That's the word that I would put at the tip. Because keeps doing reminds us that it's not enough to just do something well once. We have to do it day after day, week after week, year after year, without draining the system. So we must have a sustainable model. One of the only books that I've ever seen that was written on success in veterinary practice by Bradley Vine, I believe a former president of the RCVS, he outlined a sort of formula for success, basically around doing high quality work, which again is the idea of efficient and high quality work. But that's not enough. It must be congruent with our personal and professional objectives. So it must have this congruence with our value system and the autonomy and the place that it occupies in our lives. So the basic formula is to be good at what you do and enjoy doing it. If we have those, we basically have the formula for what most people would view as success. So that brings us to employability, one of my favourite topics. And employability is based on this idea of, or at least one view of it is based on this idea of sustainability. So employability, for those who have never heard of it, is around success and satisfaction in work. And of course, success in work and satisfaction in work means that for it to be sustainable, you need to provide value to your employer, so you need to bring value to the work that you do, but you also need to get value back. You basically need this imbalance. You need to get as much from your work as you give to it, or you will be drained. And so this is a very useful concept. So just on employability, for those that have never heard of it, this is one of the most commonly cited definitions. So it's around a set of assets or skills, knowledge, attributes that make you more likely to choose and secure and sustainably work in an occupation that you're satisfied and successful. So it's this definition that first introduced the idea of satisfaction, which really rounded out this employability model. So if you look at their model, you see there's a basket of sort of attributes, but the actual model is filtered through a layer of reflection reflective self-evaluation, and building confidence, self-efficacy and self-esteem. So basically very similar to our models of entrustment and professional identity formation. This is sometimes formulated as a key, and those elements form the stem of the key in that model. So that brings us to the Vet Set to Go project. So a little bit of self-promotion here. I was the leader of this project. When this was actually designed for the purpose of the project was designed primarily as around the transition to practice, but we felt at the time this would always be a useful framework for a whole career. And so I was really like to put it to you that this is a useful framework for postgraduate veterinary education. So this was the definition that we used, again, around the idea of satisfaction, success, meaningful work, and a lifelong career and sustainability. We also came up with later with a second definition around the idea of sustainable balance. So again, this idea that, of course, we all bring our own needs to work. We want to get something from our work wants something from us, and it's basically this exchange which actually constitutes employability. So if we have a whole range of stakeholders, clients, colleagues, employers, the professional regulators, we all have competing demands, and so you could define employability as the capacity to sustainably satisfy the optimal balance of all these stakeholder demands and to keep everything in balance. Okay, just to show you that the Vet Set to Go project sought a lot of evidence for its model, and that was the eventual employability model that the project arrived at. So it's a 5-domain model with 18 capabilities, we call them. We chose the word capability instead of competencies, just to sort of draw a distinction from the competency paradigm. So just to explain that 5-domain model, it's basically an adaptation of Ron Harden's idea of approaches to work or approaches to tasks. And you can see in Ron Harden's model, we had performance of task, approach to task, and then professionalism. So what we did, we found this idea of approaches was very useful. We viewed what we did in this model was to break down that idea of approaches into 3 domains. Approaches to work, which is professional commitment, which include continual learning and a lot of postgraduate education. Approaches to others, because human relationships are so fundamental, and approaches to self, to recognise this really critical importance of being satisfied and healthy and well in your work. So we basically sort of wrapped that around. The other thing that we did was take this idea of this sort of vague cloud of professionalism and put it right at the heart of this model. So to recognise this idea that reflective professional identity formation and building a confident professional identity is the fundamental process at the heart of all of this learning. It's the process that we started with our people climbing the dune. It's always the question of where am I now, where am I going, and how do I get there? It's at the heart of everything. So the other thing when you look at this model is you see that this reflects the fact that success in work is partly about the work itself, it's partly about the humans that are involved in that work, the people that do it and the people that you do it for. It's partly about efficacy, but it's also partly about sustainability and bringing that high quality work day after day. So I was hoping that this model might be useful to people. It was designed as basically a holistic framework that could capture all of the elements that are needed to succeed in work, in professional work. And just to show you that when we asked veterinary stakeholders to give us some statements, so this was sort of a 10 statements type model, to give us some words around what they viewed employability was comprised of, we found that it did basically fall into these categories of, so in the employability parlance, human capital, but also psychological capital relating to approaches to work, approaches to self, and approaches to others in terms of communication, teamwork, interpersonal skills, etc. But basically showed that this five-dimensional model is pretty close to what people's views are when you ask them about employability in a veterinary context. So just to show you, there are some resources available if you're interested in those, finding out more about the Vet Set to Go project. This was a recent executive summary, and there is sort of basically a little guidebook. I've got a physical copy here, which is available free online at that link. And the other good news is that it's actually, if you don't even really need to use the Vet Set to Go model, because it was actually, a lot of those ideas actually were picked up in the Day One Competencies Framework, in the little flower model. Do we still call that a flower? No? But you'd recognise a lot of the same ideas and the same words in that model. Rather than the itemised list of the Day One competencies themselves, this sort of conceptual framework actually picked up a lot of the same ideas. Sustainable engagement, continuous learning, professional commitment, and yeah, I would argue this one here probably belongs in the middle. It's really central place. It's not peripheral, it's actually at the centre of everything. Okay, so just to summarise, what we're talking about here is the what, why and how of postgraduate education. The what is these are what the graduates or the trainees or the learners are experiencing. These are the headwinds at the top of Mount Miller. This experience of complexity, developing independence and self-regulation, developing confidence, developing efficiency, finding balance in all these competing demands, and trying to integrate into a system, a team, and a new world. This is what people are dealing with. And what they're seeking then in further learning is to improve quality of care, to increase the trust and become entrusted with new skills, or to develop mastery of existing skills, but also all of these psychological factors that we just touched on, to find autonomy and congruence with their values, find connectedness to other people, to help others and to help their team, to achieve self-actualisation, become their best professional self, to do all of this sustainably in protection of their well-being, finding eudaimonic well-being in particular, improving their resilience, and employability, if we take that as a catch-all for success and satisfaction. So how do we achieve those things? Well, of course, we achieve those, we seek them through evaluation of professional identity formation. Entrustment and EPAs are widely used, of course, because they do capture some of these factors. But these are a very process-driven assessment framework that we need to use. We're not actually particularly looking at outcomes. We're actually more interested in that central process, that reflective self-awareness, the feedback and the mentoring. That is the heart of how we would achieve all of those aims in that environment. So I guess this is where I'm being a little bit provocative in terms of challenge you to think about many of you are education providers. If that's the environment we're teaching into, and that's what our learners or our trainees are seeking, are we capturing all of those factors in our training? I guess encourage you to think about whether we're actually delivering all of the things that our trainees are seeking and that they need at that stage of their career. And that is me finished.